We are beginning to record the session now. We would like to thank all our wonderful sponsors who are supporting this event, along with all wonderful participants like you, wonderful organizers, and wonderful judges. Please, let's switch to the next slide. Track G is about intersectionality. All of us are complex individuals. We belong to groups, but it's not one group that would be black and white. Some people belong to LGBTQIA+. Some people belong to different racial and ethnic groups. Some belong to different age groups, some have disabilities. And these groups may overlap even across the groups or even within the groups. In this track, we were trying to address the complex needs of these different groups and ensure that the diagnosis and treatment plans are impartial with respect to these groups. Next. We have wonderful judges ready to listen to your pitches and provide you feedback. First, we have Alicia McGregor, Assistant Professor at the Department of Community Health at Tufts University. We also have Beatriz Cantada, who is a Director of Engagement for Diversity and Inclusion at MIT. We were supposed to have a third judge. Unfortunately, she is dealing with an emergency.
I'm here now.
Oh, you are here. Welcome.
Yes.
Welcome,
Hello.
Michelle. Michelle is a research lead at the HR Advancement Center at the Center Advisory Board. So thank you to our judges. Next slide, please. We spent quite intense 48 hours. On Friday, we start with you coming up with ideas and pitching. Then people started mixing the ideas, forming the teams. People started to try to come up with their decks, pitch their ideas during the practice sessions, get feedback from judges on Saturday and Sunday, and try to get various mentoring from various judges. We iterated, and here we are, ready for the final presentations on Sunday. Next. There are 4 main judging criteria: impact, innovation, implementation, and presentation. In the impact, we are looking if the solution is solving any problem that has a pressing needs. We are also looking if the impact has a widespread public health impact. Second, we are looking at innovation. Does this solution provide convincing rationale why this solution may work? Why it's innovative? How is it different from what already exists? What is the context of the solutions, and what are the services for delivery, and what are the limitations? Third, we are looking at implementations. What is the proof of concept? Is it sustainable and viable? Is it feasible? Is the team capable of implementing this idea? Is it financially sustainable? Fourth one is the presentation. How well does the team present what the problem is and what the solution and implementation is? Next. So let's go over the simple logistic of the final presentations. These presentations are being recorded. We can have multiple team members present, and we can also have multiple teams answer questions depending on what those questions are. There are 3 minutes to present and 2 minutes for Q&A. The order is random. This will ensure that everybody has the same amount of time to prepare. We will always introduce the current team, and we will give a heads up to the next team. If you will be presenting, please raise your hands so we as organizers and hosts can unmute you. Once it's your turn, please unmute, and we will be also flipping slides for you, so please instruct us by saying the next. Since you have 3 minutes, we will measure your time. After 2 minutes are gone, which means 1 minute is left, we will show you green. After 2 minutes and a half, yellow, and 3 minutes, red. It means that your time is completely up. The judges will then pick 3 winners per each track. Next. So this slide summarizes again. Raise your hand, wait for the host, unmute, present for 3 minutes, and be ready for Q&As for 2 minutes. Ready, set, present. Next slide. Now I will hand over to my colleague, Kiliana.
Hello, good morning, good afternoon, good evening, everybody. So Kiliana, I'm a co-host together or co-lead together with Martina. I'm based in Berlin. So I'd like to call the team G26. It's the first one today, the Rainbow Identity. And I would like to tell the people from the team 24 connecting dots to prepare yourselves, and you're going to be the next. So thank you very much. The team Rainbow, please let us know whenever you're ready to start. Maybe you could change the slide. So who is the presenter for the?
I'm Lori Bauman.
Yes, okay. Please, Laurie, let us know when you're ready to start so we can start counting the time.
I'm ready, thank you.
Okay, thank you.
Hi, everyone. I'm Lori Bauman, and I represent the Rainbow Identities team. Our pitch is to improve healthcare for youth who identify as LGBTQIA+ youth of color. Next slide. This is Jordan, a high school student. All her life, she has kept her identity a secret because she was ashamed and feared rejection and retaliation. This has greatly affected her self-esteem and mental health, and she often feels lonely and depressed. She is one of about 1.5 million LGBT youth in the United States. Next slide. Our solution is to make youth the teachers. Our team proposes a 4-formula solution: authorize, action, data, and vocalize. We plan to develop a safe workspace on an app and recruit LGBT and BIPOC youth through partner high schools. Next slide. Youth will be encouraged to tell their life experiences through role plays and stories. Next slide. Their stories will be curated and translated into action items. And next slide. These will be shared with their consent with healthcare providers. Next slide. Youth will share their stories and life experiences through surveys and provocative questions on the app. Next slide. We will offer youth opportunities to improve the current medical school curricula that are used to educate students and providers about LGBT youth. Next slide. Ultimately, we will offer curricula to medical schools and providers for continuing medical education credit. All data provided by youth will be strictly confidential and individuals will not be identified. Next slide. Our competitors have multi-session curricula on providing healthcare to LGBT youth. However, these are complementary to what we propose. They focus on medical care and not on the communication, trust, and respect that's so important for these youth. Next slide. We will partner with high schools to distribute the app to our app users who are LGBT youth. Through sponsorships with CDC and potentially commercializing to the insurance companies, we will distribute the stories and data collected to our target audience, which is the medical system. Next slide. With a freemium business model, youth can access the app for free. Reimbursement may be possible if we can show savings to insurers if LGBT youth use routine medical care. As a nonprofit, we will seek financing through CDC, through state and local sources and sponsorships. Benefits to society include improving healthcare and reducing tragic outcomes such as substance abuse, depression, and school dropout. Next slide. This is Rainbow Identities, a diverse and talented team that believes that LGBT and BIPOC youth need a voice and that providers need to listen to it if we are to improve healthcare for LGBT youth. We want to sincerely thank all the mentors who provided invaluable feedback. Next slide. Thank you.
So thank you very much, Laurie, for a nice presentation. We would like now to have feedback from our judges. Maybe I would suggest that Alicia starts deliberating. Please go ahead.
Sure. Well, first of all, thank you so much for the excellent presentation and proposal on what's surely a critical issue, especially at our time when mental health and especially, outcomes like suicide are rising in the United States. I think this application and this idea is a wonderful idea. I do have a question. I don't know if this is the right time to ask a question. Is it?
Yes, you can ask a question. We only have some minutes for the deliberation, but please go ahead and ask questions to Laurie.
Okay, sure. So my question is around the participation from the young people. So I understand that you'll distribute through high schools and through partners. But how exactly does your organization plan to incentivize young people's participation? You know, what draw would it have for young people to download this app versus another app and the many apps that they're constantly on that are competing for their attention? So that's my question, but wonderful, wonderful job.
Thank you. So we plan to involve youth from the very beginning in how the app is designed, what would make them interested in participating in it. Our experience in working with at-risk youth is that they're seeking a way to make their expertise available to others. They're so often disrespected that the opportunity to have their opinion sought after and being able to provide it to the providers who they see is generally a very big incentive. But we will certainly be involving the teens themselves to make sure that we incentivize them in ways that are meaningful.
Okay, thank you. Thank you. But I would like now to have Beatrice giving her feedback. Beatrice, you would
Yes.
like to say something? Yeah.
So I'm very excited about this app. Just thinking about how we're meeting the youth. They're very much in social media, using their phones. So trying to meet them where they're at. And I know this is somewhat similar to the question that Alicia had asked about, like, what is it in it for their students, right? And how do we convince them? And my more prolonged question is, what is the immediate incentive? How will they, be willing to see a difference, whether it's in their school or healthcare? Because again, what I'm hearing from you is it will be the healthcare that will be informed about how to work with the students, but what is the immediate positive impact on the students?
Please, team members, jump in anytime. I don't mean to monopolize. I think there are several. One is the opportunity to talk to others like them. As we've said, they are so isolated and have had so few opportunities to meet others like them and to share their experiences that very often that is a huge incentive. I also have seen that these kinds of programs can be given after school credit or community credits, many of which are required as part of high school. And so we would clearly work with the schools to make sure that whatever time that they were investing gave them either school credit or after school credit. But I also think that we would be involving on the app opportunities for them to tell their stories directly to providers, mentors, and others. And that can be very rewarding as well.
Okay, thank you very much. And now I would like to have a Mika.
Yes, hi. Thank you again. So I think what stood out to me was the opportunity to be able to educate providers. I speak with a lot of healthcare organizations, and many of them, I think, have a lot of questions about how they should be training their staff. I think my question would be around how you see that being integrated into regular education for providers. Like, often certain trainings are only once a year. So I wonder if you all talked about kind of what the vision is for making this type of education compelling for healthcare organizations.
Yeah. So maybe Laurie, I would like you to give a very short answer so that we go ahead with the further teams.
I understand completely. My vision and dream would be to integrate it into the curriculum for medical school students so that it would be part of their early training, Second, almost all medical schools particularly have monthly CME opportunities, as well as grand rounds and other opportunities. So my argument would be integrate it where it's already appropriate and not try to create a new channel, because it's less likely to be adopted and sustainable.
Okay,
Right.
thank you. Thank you very much, everybody. For the judge, this was the team 26. Okay, so next slide, please. So we have chance to fill in the forms for this team 26. And now we're going to be having the team 24 connecting dot. And the next team will be the 11 multiracial identities. Please prepare yourself. You are the next. So please, the next slide. And please, team 24, identify yourself so that you can be unmuted and let us know whenever you want to start your presentation. Team 24, you already there?
Yes.
Yes,
Yes.
so let us know so we can start counting your 3 minutes.
Okay, I believe we're ready.
Okay.
Okay, good morning. We are connecting dot. Next slide, please. Did you know that 72% of people rely on the internet to search for a healthcare provider? That it takes around 18 minutes for a doctor to spend time with their patients and diagnose them? And that 1 out of 11 Americans use government funded institutions for their healthcare? Next slide, please. The problem that we're looking to address is that there is a lack of personalization and identification in government-funded healthcare systems. Next slide. The barriers that we're addressing are the lack of options for provider search in terms of their demographics, the dismissive physicians who don't identify with personal factors such as race, gender identity, and gender pronouns, and the lack of holistic care of providers seeing patients as patients and not as numbers. Next.
Here's the current scenario to find care. We start with a basic Google search of, let's say, Medicaid providers in California. Well, we find our list of providers, but the filter options are pretty limited. We need a better way to find providers. Next.
Presenting Connecting Dot. Our main aim is to match patient to healthcare centers based on their need and preferences. We allow patient to add a personal story, have filters such as pronouns, ethnicity, language, and share the information, making the whole process more streamlined, efficient, and seamless. Next slide, please. Throughout the hackathon, we were able to build a small prototype. Once a user logs in, we will ask the user to take a small assessment test, and through this test, either they can scan their records or fill in the details. We will ask them general information, background, medical history, income group. We will also ask them to share a story where they can talk about the trauma, childhood trauma that they had, their mental health records, any kind of information that they want to share with their healthcare people. Once the information is shared, we will be providing them with a recommendation, and they can filter out that recommendation based on the filters using like language, pro bono, insurance support, and all. Once we have that information, you can set an appointment based on selecting a department, slot, and your condition, and also share your EMR report. Next slide.
The competitors that we researched were ZocDoc, Wello, and Better Doctor, who all have filtering capabilities for patients to find adequate care. The way that we would differ from our competitors is we would use comprehensive filtering capabilities based on traits of intersectionality, such as pronouns, race, religion. And we also have the capability to present personalized information to providers so that they can provide more holistic care. Next slide. Our target audience is government-funded healthcare clinics and providers, as well as patients who have no insurance or utilize government-sponsored insurance, such as Medicaid. The backers we are looking to partner with are nonprofit insurance companies with goals to give back to their community as part of social and community determinant programs, which will allow them to maintain their 501c3 status as nonprofits.
For security, we are looking into data warehouse such as Salesforce that abide by HIPAA compliance and regulation. We will be doing periodic audit trails. We will also have like end-to-end data encryption, and this whole process and information sharing will be password protected based on, we will be giving them role-based access. Next slide, please. We are Team Connecting Dot, and thank you for your patience and listening. We are open to questions now.
So thank you very much. It was a little bit above 3 minutes, but you managed the last slides quite fast. So hopefully the judge they were able to understand. But maybe we could start again in the same order. Maybe Alicia. And I would
Sure.
kindly ask the judge to keep short so that we don't go much over. So I would say like 1.5 minutes.
Okay, sure.
Judge. Okay,
So
thank you.
excellent presentation, excellent idea, especially thinking about intersectionality, for example, for marginalized groups. If I was a trans person who wanted to go in for IVF, you can imagine it's really important to know that my physician would be someone who really kind of supports who I am and what I'm trying to do. So I think it's an excellent idea. I'm really pleased that you guys addressed the security issue, because that was the question that I was going to ask. For example, how would you make people feel comfortable sharing information about their own personal trauma in the app? So my question, if any, is similar to the last group, really. What's your plan for marketing this app and getting folks really on board to kind of share this type of personal information? And how would you put people at ease as they're entering their personal info in this app?
For marketing the app, I think that it would be best to do so via the backing company, the backing insurance company, to allow users and give them an easy way to find providers. Because at the moment, what they have to do is call into an insurance company, and that's during the regular work hours. So if you're a working person, you don't have the opportunity to find a provider that suits you. And in terms of making them feel comfortable sharing this information, we find that people aren't comfortable sharing information in person because they're not usually asked these questions. So to be asked these questions, even if they don't answer it directly in the app, to know that a provider actually cares about them because they have the opportunity and they've seen these questions asked of them even on their phone, will allow them to feel more comfortable providing this information in a safe
Team
space.
24, thank you very much. The judges, I would like you, if you could, we could do a little bit faster. I'm getting signs from Martina that the time is running and we need to be ready for the final. So if we could, I would ask then Beatrice to give like 30 seconds, a comment, and Mikael as well later on. Thank you.
So, how would you address potential audience that English is not their first language? How would they complete this app? What if you also don't have a smartphone or access to a computer? Would they be part of the demographic that you're reaching out to? And how would you make sure that the app is accessible, thinking about the differently abled ways we interact in this world?
Sure.
Yeah, so I will take that question. So finally, when we were doing our user research, so we have this plan of when they're logging in, they can even at the start only, they can have this language support. So they can choose a language in which they want to proceed with the form filling. And with people like smartphones, I think our primary focus for now is the people who are the 72% people who are actually going through internet and searching through all the list. And then once we have that persona onboarded, we will scale it up to even people with no internet background, or like maybe we will have like a more SMS kind of service. So we will look into that as well.
Okay, thank you. So the judges.
Yes.
Another
So
question.
just a few comments. I think that it would also be interesting. I don't know if you wrote this up in the prototype, to factor in convenience and just accessibility of the location of providers. So that's potentially something that you've included. I think the other thing would be, can the person who's using the app request, like depending on, maybe you have a scale about their level of health literacy, so that the provider can then accommodate certain things that might not necessarily be about language services or that kind of thing. And then I also have a question, which you don't have to answer, just about how does a provider use the information? So how do you expect them to do that? Would that reduce the intake time? And then would they be able to develop more suitable health care plans for people? So just a few comments. Thank you.
Yeah, I'll take that question. So a lot of times, like for providers, since we only have a short amount of time, like the average time is 18 minutes to be in the office, a lot of times, a lot of the information that's already being sent over from like request of information from like different care clinics are sent through like through like MyChart or whatever. And they have like all this like information, but it's not like consolidated or concise in a way like our app would be. And a lot of times like medical assistants, they'll be the ones like reading it and like saying, hey, like this is like, you know, the next patient, just kind of giving the summary as well. So just kind of like making it a bit faster for people in the back end to understand, okay, like this is who they are, this is what they're, you know, dealing with, this is the trauma that they've had, just short, concise, ready to go. Instead of having this inundated information from these clinics that are like thousands of pages of medical history and records that don't really explain what the person went through, more of like just like the statistics of it.
Okay, thank you very much, Team 24. It was a really nice presentation. Thanking the judges. So now we need to go ahead for the next presentation. You're welcome. It will be the Team 11 multiracial identities. And the next one will be the healther. Please prepare yourself. And so Team multiracial identities, identify yourself so you can unmute you. And whenever you're ready to go, please let us know. And please, the next slide, the first slide from the health, from the multiracial identities.
Great.
It's a priest. I'm sorry, I made a mistake, right? It's a priest, please.
Oh yeah, it's okay. It's just
yeah, okay.
can everybody hear me? Am I unmuted?
Yeah, please let us know. Yeah.
Ready whenever.
Okay, please go ahead.
I'd like to tell you about PRISM. People who possess multiple racial identities are often forced to choose only one on intake forms or sometimes the other race category. This can lead to inaccurate data collection, and patients who might be predisposed to certain genetic conditions may be overlooked if not able to fully report their multiracial identities. How do we give people who have been historically in the other category the representation that they deserve? Next slide, please. The 2010 US Census data shows us that more than 21 million people classified themselves in the other race category. For context, 21 million is the number of global COVID-19 cases as of August of this year. It's also the number of Americans that suffer from addiction today. This is no small number. Next slide, please. This is Mateo, a 7-year-old boy who walks into the pediatrician's office. For the first time, he has to classify himself within a set of race options. His mom is Afro-Latina and his dad is Asian American. The available options can't accurately capture Mateo's racial makeup, and he is forced to check mark the other box. Next slide, please. Our solution is to develop an app that will allow people to report their racial background in a non-binary way. The algorithm will accurately report people's multiracial makeups, and multiracial individuals will no longer be homogenized into a single race. Users will be able to report their ancestral racial makeup to the best of their ability using their parents and their grandparents, their biological parents and grandparents, which will allow for more nuance in clinical studies and patient care and allow us to see exactly how their breakdown works in a three-dimensional way rather than just on a piece of paper. Next slide, please. So our value proposition is to report race accurately for medical and research purposes. We're looking to partner with clinical practitioners to tailor medical care to each individual. Our solution can be utilized by researchers and especially starting clinical trials. We're looking to engage researchers in general to establish a cost revenue stream from research companies. Next slide, please. The mobile application will have a fast adoption, low cost, and will be user-friendly. The menu to select one's race will be visually appealing with little text so that there is no language barrier, and easily tapped on a mobile device or a tablet at a doctor's office or research facility. It can be used supplementarily with existing demographic forms. So say at a physician's office, they don't have to refill out all of the forms. It can just be an add-on. It can be implemented into various offices such as clinical trials, labs, doctors, schools, etc. Next slide, please. Our team is myself, Bryce, a community activist with a background in education and entertainment, Mariana, a specialist in multinational and multicultural communications, Albert, an organizational developer, and Lenara, an agronomist. Thank you.
Thank you for the presentation, right on time, as I see here. Thank you very much. And to team 11, and I would like now to go to the judge, Alicia. And I kindly ask the judge to not to restrict the amount of questions. I know that is very tempting, but we have some timelines, tight timelines. We want to be on time, ready to finalize the winners, to judge and find the winners and finalize the presentation. So thank you very much, Alicia. Please go ahead.
Okay, absolutely. So wonderful presentation. Just a brief question about really how the app works. You mentioned they would fill out the information for both parents, and then after that, who exactly gets the information? That's my only question.
Yeah, so the information will go to, it will be specifically requested by, or the information will be available through a physician's office or a research facility that people go to. So that that place that will administer this information or will collect this information. So it won't be like a generalized thing that is sent to people. Each patient who's filling it out will know exactly where their information is going because it's only to that specific person that's asking for it. And depending on what that is, if it's a clinical trial, if it's a physician.
Yes.
Mine is more comment / question. As you know, great presentation. I'm thinking about how about patients, young ones that are adopted or may not know their ancestry. So how would you address that?
So that's kind of one of the, I guess, pitfalls of this is it's to the best of your ability. We know that there are supplemental things like, you could take a DNA test to identify some of that, but that's kind of out of our realm. This is meant as still within the realm of like a personal reporting. And it's just to help it make it, I guess, more accurate for as many people as possible while recognizing that there are certain people that unfortunately that is not going to be possible for within that.
Okay.
They will be able to opt out if they don't know.
Yeah, all these options are optional. It's just as much information as you can provide or willing to provide.
Okay, thank you very much. So Mikal?
Yeah, my only comment is it seems like there would be a lot of benefits to like providers and to researchers, and I am a little bit less sure about the benefit to the end user in the immediate term. So I don't think you have to respond to that, but just making that comment. But I think it's a really great idea.
So then thank you very much to the team 11 and to the judges. And next we go to team 22, the health team. And so just reminding was team 11 judges so that we will tell me if you are ready with the grading. And so that the next team will be the refresh, the team 004. Please get ready to go because you're going to be the next. At this time, we go with health. I ask my colleagues to put this slide. And raise your hands so the colleague can mute yourself. And let us know whenever you're ready to start.
Thank you. I'll start, and Chetan will be taking the second half of the presentation.
Okay.
My name is Debbie Cantor. Thank you to MIT Hacking Racism. We are developing a one-stop shop platform with a couple elements of some of the prior wonderful presentations we saw, but our goal is really to be a platform for everybody, but to focus on vulnerable youth within the LGBTQ community to help them access medical, social, and mental health services. Next, please. These are the facts, and I know them firsthand. I conformed for my first 35 years, was married to a man. I now have a wife. I'm a nurse practitioner, and I've seen both sides. Had I not had the services and resources I had, I probably would not feel as comfortable in my own skin and then would still have the terrible insomnia that I had back then. Within the youth LGBTQ, suicide rates are much higher. You're much more likely to delay receiving health care that you need, and only 9% of providers are trained with the sensitivity that we had mentioned in the prior presentations. Next, please. Our solution is to leverage AI and already existing social media platforms. Our goal is not to recreate the wheel, but rather to do our back-end research to figure out what needs must be met and gather already existing platforms and put them all as links into ours to provide a one-stop shop for resources. Next, please. So we will have hot link buttons that will incorporate things, including information about the new 988 suicide hotline that was just signed into law yesterday. Things like the Trevor Project to talk about suicide prevention. Our goal is really to discover, based on clinical evidence, what topics are most crucial for this vulnerable community, but do it in such a way that youth will go there for chat rooms and other social media. Next, please, Chetan.
Yes, so the app will provide links and numbers like the 988, which is the local abuse hotline, and also some other suicide prevention services. And for medical health, services, we have multiple links for telehealth and medical services. Then we also polled the MIT hackathon and showed that 91% agree that we should provide rate providers for LGBTQ sensitivity. Then for social media apps, we can include links for meetups, video calling functions. Then next
So
slide, please.
you have 15 seconds to finish, okay?
Yeah,
Please go
okay.
ahead.
So over here we have a very elaborate business plan of extending up to 1 year. We have decided that we will partner with already existing researchers and then raise funds and develop our product further over the course of time. So we do have competitors, two of them, one is in Australia. But they are not as effective and not as functional. And we will try to inculcate as much as we can and implement as much as we can in the app. Next, please.
Okay.
Next slide, please.
So thank you very much for your presentation.
Yeah.
Very nice. I would like to now invite the judge, Alicia, to comment.
Sure. Again, excellent presentation on a critically important area. Could you elaborate just a little bit more on how exactly the app would work? So you said you integrate social media and AI, but I wasn't clear on how exactly it would work. If you could just describe that again really quickly.
The goal would be, yeah, Chetan, go ahead.
Yeah, so many of the LGBTQ members are actually facing a lot of depression, anxiety, and stress related to daily discrimination that they face. So so the app will actually ask the people their mood, and on basis of that, it will draft a course of action so that people can take steps towards fighting against this depression that they are facing. So and it will also provide a platform for socializing with different people in their own community, so that it kind of strengthens the bonds, and they won't be afraid to come out in the open. So that's what we are looking for.
Thank you very much, Chetan. Thank you very much. So we would like to go now to Beatriz.
So it seems like your end user are the youth, right? And how are you going to reach out to them? Are you going to partner with schools? Like, what is your method? How are you going to encourage them to use the app?
So the goal would be really that anybody under medical care or in school via the school nurse, they could have incentives to introduce it. It could be part of curriculum as well. There could be incentives to insurers or primary care, and to introduce it really as a homepage, a default setting, somewhere to go where you can check in. And so it would just become a more mainstream, check in there, like a LinkedIn for professionals, but it's a youth-based check-in platform.
Okay, so thank you very much. And I would like to hear Mikal for your comments.
Yes, not a lot of comments. I would just say, I think, Debbie, based on what you just said, that you highlighted what is the core purpose of the app, because it sounds like there are a lot of different components in it, but it sounds like you're highlighting that the checking in with each other, building community are at the core of what you're trying to achieve. So thank you.
Thank you.
So thank you for team 22 healthers. So now we'll have the team refresh. And next slide, please. refresh is the team 04. I kindly ask you to raise your hands, identify yourself. And to the team 25 seashore, please prepare yourself. You are the next ones. So we could put in the next slide and team refresh, tell whenever you're ready to go so we can start counting.
Hello, am I audible? Can you hear me?
Yes, maybe a little bit louder.
Can you hear me now? Is that better?
Yes, it's better.
Okay. Let me give me one moment. I gotta close so I can see the screen. Okay, I'm ready.
Okay, please start.
Okay. So we are a refresh, Education 2.0. Next slide. So Lily is an African American student. She's dealing with anxiety, stress, and depression in the classroom. Next slide. She's not alone. Worldwide, there are many students who deal with this exact situation, but you don't ever hear about it. For example, 50% of students with poor mental health tend to drop out of school. You can call it a silent epidemic. Next slide. Healthcare and education go hand in hand. You need both to be in good shape. Students in these marginalized communities don't really receive these resources due to them not getting the support they need because of the attached stigma that comes from the community they fall in. Next slide. This is mostly due to most instructors not being able to deal with these types of issues. So people like Lily may fall back academically or mentally. Next slide. So our solution is to create a way for these students to get the feedback they need and also assist the instructors and parents in giving them said feedback. So we've designed a mobile app that will form a feedback loop between student, parent, and instructor. The instructor can give data on how the student is doing based on their performance. This way, the student can see exactly where they're doing well and where they're not. The instructor also has access to this and is able to help the student where they need it. There will also be input from the student and parent where the student can say what classes they have a passion for. We also use data based on how the student is interacting either by speech or text to determine how they may be feeling. This can help the parent and instructor help the student when they are, say, stressed, for example. Next slide. With a tool like this, people like Lily can get the support in school they need no matter what community they fall under. The instructors will also have an easier time gauging how a student may be feeling or if the student is dealing with anything or if they have anything going on. More of these people will then be able to exceed with both good academics and good mental health together instead of one compromising the other. Next slide, and to you, Joe.
Yeah, when you look into this competitive landscape, you can look clearly that our application stands out since it promotes the mental well-being as well as the education. So they can both succeed together, not just one or the other one. Next. Yeah, when you look into the implementation, how you can prepare for the GTM strategy. So we are mainly focusing on the subscription-based freemium model, and who are our stakeholder? Our public school, teacher, student, community, and parents. And the customer will be the education system and schools. And we are mainly focusing on the social emotional learning, SEL score as a North Star metrics. But apart from the North Star metrics, we are mainly focusing on the daily active user, monthly active user, all the KPIs to make it successful. Next slide. Yeah, we hope our solution can bring the change to this world of mental health with proper education system. And here it is our diversified team.
Thank you very much for the presentation. Very nice. And I would like to ask the judge, Alicia, to comment.
Sure. Very, very, very wonderful presentation. I'm curious about the freemium subscription model that you plan to use. How exactly will it work, and at what point will you begin to charge end users to use it? And have you thought about how much you would charge them?
We haven't really thought about the pricing. I feel like a freemium subscription because I feel like it should be something that will go out like with schools. So something you do since it's like a like a learning management system kind of. So I feel like you would pay for the subscription. Like when you say you put your student in like the school that has it, you can choose whether to subscribe to it or not. I feel like for freemium, I feel like they should be able to try it out first. So maybe something like maybe a trial, or maybe they can use, maybe there's a few, like, I feel like a trial would be the best idea, honestly.
Okay, so thank you very much. So would like to hear Beatrice.
So if I were that young student and I had this app, so how would I be the ideal user? Am I completing how I'm feeling every single day? Is that the point of the app from a student's perspective? Do I say this is how I'm feeling today, and then the next day and the following day, and then what happens with that information?
So the idea is, as the student uses it over time, if when they interact with their teacher, maybe they're working with a teacher privately, or they're sending messages with their instructor. The idea is for it over time, the algorithm can, based on how the student is speaking or how they're typing, what kind of language they're using, and so on, it can it can kind of determine how they may be feeling. Um, if the person, because I feel like most people don't feel comfortable just saying it outright. It's kind of hard to communicate if something's wrong, you know? So I feel the program is supposed to help the instructor pick up quicker on some telltale signs if something may not be okay.
Okay, thank you very much. And I would like to hear from Mikal.
Yes, love the idea of being able to have students kind of name their emotions, or to learn that through how they're interacting with the app. I think my big question mark, which is not for a response, is more about the time that it might take. I know most people I know who are teachers are very limited on time. So I have a question of, will they have the time to interact with the app in the way that you want? And then will they have the time to customize their approach to working with their students based on what they learn through the app? Thank you.
So you want to answer these questions or comment, or it's fine?
So
if we don't, okay.
We have already shown in the competitive slide, right? Competitive market landscape. So our product is the real-time monitoring system. It will provide the real-time feedback, so they can access the real-time data. So that's how, okay, this week I have this report, and how I can proceed further, whether it is a positive feedback or negative, I need to focus on the negative point. So next week I can come up with a strong motivation. So how I can take it to the next step. That's how each stage of the life can be successfully had.
Okay, so thank you very much. The team 04, refresh. And I would like to invite the other team, the next team, team 25, Seashore, to identify yourselves, raise your hands, and also tell the team mHealth 16 to prepare yourself, so you're going to be the next. So whenever you're ready to go, please let us know so we can start counting. Hi.
I'm Asim from Team Seashore, and I would like to ask you, how would you feel if you were cast away alone on an island? Next slide, please. This is Karishma's experience of that. Karishma is a dark-skinned transgender woman from Karnataka, India. And in her own words, she has said, I've always felt that I have been stranded alone on an island. Other children used to harass me in school due to the differences in my color, speech, and tone of speaking. Because of it, I felt unheard. Before people even know me, they are prejudiced, and nobody even tries to listen to with an open ear. Because of this, I'm suffering from depression and I have suicidal thoughts. Next slide, please. The LGBT community faces mental health challenges just like everybody else, but they face even more hurdles because of the existing prejudices in our society. 61% of the LGBT community have faced depression in their life, and 40% of transgender people have attempted suicide. Next slide, please. So we decided to go ahead with the problem statement that how might we enable unprejudiced interaction amongst people and help build cross-sectional empathy. Next slide, please. So our solution is Seashore. Seashore is an application which helps distressed individuals to share their experiences anonymously with others and manage their anxiety and mental health. Our users can be anybody who has ever felt unheard and faced discrimination. They can benefit from our solution. Next slide, please. So sometimes all of us have felt that we are stuck on an island, but we are not alone. Everybody is stuck on an island. And like you send some bottles to other people, with some messages you have sent to other people, and some messages have also ended up on your shore, and you can talk with them. This is an unprejudiced way of interaction in which there is no name or a pseudonym, no name attached, no nothing attached, and you can talk freely, share your experiences. Our application helps anonymously share a user's vulnerabilities and make them feel heard. You can share your thoughts, experiences, and vulnerabilities in an unprejudiced environment. You can empathize with people from different walks of life and gain a wider perspective. Next slide, please. 41 million people use, 41 million messages are sent every minute, and it's a lot of messages are being sent, and there can be a revenue stream of up to $15 per user through ads on messaging platforms. Next slide, please. This is our business thing. And this is our business model canvas, that our core value proposition is that we enable cross-sectional empathy through unprejudiced communication, which will lead to a more accepting society. And our customer segments are everybody who has ever felt unheard or discriminated. They can be our customers. That is it. Thank you. Next slide, please. Thank you for giving us this opportunity.
Wow. Thank you very much. It was exactly 3 minutes. Really great. So I would like to invite Alicia to comment.
Sure. So first of all, very compelling presentation. You guys are making a really bold step to build what you call cross-sectional empathy, which I think is very ambitious and revolutionary in a way. And you tell a really great story. My only question is, with the way that the app works, how exactly is it that folks will be able to communicate with each other to really build that empathy? I didn't quite catch the way that people interacted with each other on the app. Could you describe that again?
Yes, so there is this visceral level of interaction where you do not, you are just looking at a thing or a product or a person, that it is an inherent trait of ours, every human. And at this visceral level of interaction, we make some judgments about the thing, about the person, and sometimes our judgments, they are like subconscious judgments, and because of systemic unconscious biases that we have, they sometimes go in negative direction. In our solution, because we are not attaching any identity to a person, just a pseudonym, if they want that, then their message, the what you are going to get will be similar for everyone. There will be no identity attached there. And because we have placed everyone in a similar environment, that everybody is stuck on an island, so that empathy starts from there, that everybody is stuck on an island, and we are doing that. If
Okay,
that answers it.
Thank you very much. So we'd like to go with Beatrice.
So how would you moderate the interaction or engagement in this app? I'm more concerned about folks who have bad intentions or are not there for empathetic reasons.
We are going to have zero tolerance policies for bullies, and we can, in the sign up, when they are signing up, we can ask them to sign up through their other platforms like Facebook or Google, or we can ask them to sign up from their numbers, so that we are able to identify people and somehow moderate them.
Okay, thank you very much. Very clear answer. So now we'd like to have a Mikal.
Yes, I wanted to know how you plan to measure the outcomes of the app. Like, what are there going to be potentially surveys or something that you want to do with the users to understand how these interactions are impacting their mental health?
We haven't really thought about the testing phase yet, but I'm sure we will figure out a way.
Well, thank you.
Okay, thank you very much. This was the team 04. No, the 25 Seashore, right? Judges,
Yes.
25 Seashore.
Yes.
Yeah, so that now we go to the next slide. We'll have the team 16 M Health. And please raise your hand so that we can unmute yourself. We can unmute you. And then we ask the team 18 Hippocrates to prepare, so you are the next ones. So now we are with the presentation.
Am I audible?
Is who is, you don't need to share, I mean, who is sharing? Is it Dana? Dana? You, okay.
Those you don't need to share.
No, you don't need to share. We have the presentation for you, right? Dana?
Yes, let me just get it back. I think we lost it just because they shared the screen. Okay.
Okay, you don't need to share a screen. We have prepared a presentation for you. You just need to present. Hold on a second. So the next slide. And then whenever you're ready to go, please say that we can start counting. And please say next slide, right? Whenever you are ready to have the next one.
Please begin. Next. Mark is queer and black. After an event at a doctor's, he is uncomfortable in terms of his sexual choices. Now he finds meeting a doctor willing to treat him is much harder since his first encounter. Mark now has a severe disability, so he needs to find a specialist fast. We want to help Mark. He shouldn't need to go miles away to find an affordable doctor. How can Mark be better equipped and informative of and within the institutions he is understandably distrustful of? Mark's story would be different if he had met an empathetic care professional and was connected to his peer community and support group. Next, please. We aim to address this issue in the spirit of Sustainable Development Goals 2030. We present mHealth, an app-based platform which provides state-of-the-art, inclusive and personalized healthcare opportunities. Next, Mark subscribes to the app. He finds recommended peer-reviewed empathetic healthcare services suited for his needs. But that was the first of his surprises. The system has access to a variety of healthcare databases, especially systemic determinants of health data on minority groups. It also collects anonymous survey data from target group clientele and their health data, comprehensively analyzes it. The app helps foster individualized medicine based upon intersectional predeterminates that leads to higher quality healthcare and provides precision-guided healthcare activity recommendations to participate in, helping users understand what they should be doing regarding their specific health needs. Next, please. It provides seamless implementation of the solution through a dynamic support system of AI, local professionals, peer groups, and community health workers, hotlines for abuse and mental health issues, legal support and financial support as per the necessity. Next. Currently, we are way ahead of our competition. Trans Lifeline is only a hotline for trans in need. MindOut is a support group for LGBTQ members. Lighthouse only connects to a fixed LGBTQ friendly doctor network. Rest of the apps are nowhere as sophisticated as ours. Next, please. We can gain funding for this through philanthropic organizations or through CSR or NIH SBIR grants for reaching out to target population. But our plan, if scaled up, can initially start as a subscription-based revenue model with partnership of large corporations or payers. We have other affiliate revenue stream as well. Next, please. Say for the next 5 years, we collaborate with corporations like Walmart or Target. Even at a low subscription cost of 50 cents per member per month, we can generate large-scale profits while slowly shifting to risk-based revenue model. The revenue stream can be utilized for our target population. Next, please. I believe in this idea as it's not only sustainable and relevant, but it has the capacity to change the lives of millions of Marks out there and can perhaps become something much greater. Next, please.
You have 15 seconds to finish.
Hack has managed to bring together people of diverse skill set from all over the globe. And lastly, I would like to thank our mentors, Mr. Sab Sinha, Mr. Patrick Luther, and Mr. Rajesh Ranjit for their guidance. Last slide, please. Thank you.
So thank you very much for your presentation. This was the Team 11, the mHealth, and I would like to have comments from Alicia.
Sure. So very diverse and well-rounded team and excellent and innovative idea. So my questions are concerning, well, first, you mentioned the Sustainable Development Goals as sort of the way that you frame the goals of this organization, this project. And I wondered, is your audience domestic as in the United States, or is it global? Because I think that would shift how you would frame the app. And then secondly, what kinds of education would you provide to the physicians who would receive the information from the patients, for instance, related to the social determinants of health and more? And how would you make sure that physicians themselves were literate in all of these, all of this type of data that they would be receiving from patients, that they would actually know how to use this data?
Okay, so for the first question, because this hackathon is based on US, so we were thinking on the model based on only on US. But of course, as we globalize, it will have to have other features, including availability in multiple languages and other sorts of stuff for going on a global scale. Secondly, the health education. There will be two types of people who are registered. First are the users or the patients. They are mainly we're focusing on them as we are giving them recommendations because many of them are vulnerable to specific types of diseases. So what kind of healthcare recommendation or dietary practices or what kind of schemes are more beneficial to them, it can be tailor-made towards them. And for the doctors, since they are already getting a rating and they are mainly, and they will be sensitized towards the specific needs of the LGBTQ and disabled communities and the ethnic and racial minorities.
So Health team, thank you very much. I'm so sorry, we really need to rush a little bit because we need to finalize. I would like to go to the next judge and not to the next presentation, but we would like to hear the next, the Beatriz.
So quick question, just confirmation, are you group 16 or 11?
This was the 11. Oh no, I'm sorry.
I want to make sure because I want to.
The 16, it was my mistake. I'm so sorry. It was the 16, right? Okay.
So Arjit, very good presentation and for you and the rest of the team. It sounds very comprehensive. I'm wondering, where does the research, or who are you partnering to make sure that the research is front and center and part of this app?
Okay, so the database systems which we are going to use are for especially for the minority groups are CDC's SDOH data and the 2017 LGBTQ SDOH data. It was made by collaboration of Callan Lord, the SAGE Foundation, and the Center. So SAGE Foundation is Shared Services Collaborative Data Services and Advocacy for GLBT Elders. It's USA's oldest organization to improve health of older adults in this community. And the center is established in New York, in the heart of New York City.
Okay.
So,
thank you very much. Maybe we go to Mikal.
Yes, so there are lots of great components to the app. What do you see as the most defining feature of the app that's critical to its success?
The most defining feature is it helps fostering individualized medicine. So based upon the intersectional predeterminates, it is providing the user to a peer-reviewed, for sheer empathetic healthcare professionals who are well suited for their needs. So this is the basic target of the app. Other than that, there are lots of supplementary features.
Okay. Thank you very much for your answers and your comments. We'd like to go ahead to finish to go to the last presentation because we're running out of time. So we have the next team. Is the team 18, Hippocrates. Please identify yourself, raise your hand, and let us know whenever you're ready to go. And please, next slide. Yes.
Ready to go.
Okay, fine. Just go ahead.
Hello, my name is Isaac, and our diverse team from Nigeria to the United States include Mahidi, Ibube, and Sandy, and we are the Hippocrates, maintaining oath. Next. Meet Michael. Michael, like everyone, wants good quality healthcare. However, Michael is an indigenous trans male. This means he faces more discrimination from healthcare providers than many of his peers. Also, with current changes in our law system, he also can be legally discriminated based on state and federal laws. Next slide, please. What happens because of this? We have morbidity and mortality due to lack of preventative care, screening, stress and mental health, and risk of substance abuse. Next slide. When patient-specific barriers, we have issues like fear or anxiety, denial of care, low social economic statuses, to name a few. Next slide. And we also have provider-specific barriers like discrimination, poor provider comfort, and poor provider knowledge. Next slide. The solution is Hippocrates. What we want to do is empower patients of the intersectional LGBTQ community on healthcare while giving resources and holding providers accountable of optimal services. And how we do this? Next slide. So in the first image, we have a provider profile that allows video feed to really get an idea of who the provider is. We keep them accountable based on a recommendation, rating, and rank system. We also reward them by informing potential patients with a badge system that lets the patients know what experience and training they have based on those badges. In the second image, we have a provider resource feed where the provider can get access to training curriculum from educators and trainers. And on the last two images, we want to make this process for patients easy to connect and find the healthcare provider and service they need. Next slide. Customer segments, we're looking at people between the age of 18 and up in the LGBTQ spectrum. For healthcare providers, we're looking at the LGBTQ knowledgeable providers or people who are hungry to learn. Next slide. Key partners, we're looking at patient, healthcare providers, healthcare institutions, and insurance companies. We've looked up that $3.7 billion is saved based on preventative care, which is lacking in these communities. Next slide.
Isaac, you have 15 seconds.
Revenue stream, we have advertisement, subscription providers, in-app purchases, data collection. Next slide. Next slide. And thank you.
So thank you very much for your nice presentation. I would like to go ahead with Alicia for commenting.
Okay, wonderful presentation. My only question is regarding the subscription for providers. How exactly would you incentivize providers to subscribe to this service? Really, what's in it for them?
So when we did our research, we found out that like 94% of providers want to get access to educational information on healthcare, but it's just hard to find for a lot of cases. There's no like central place you can get this information. That's what our app would do. It would be a centralized place for the educators to get that information. And we think we can incentivize that by making the process easier for them to get the necessary training that they need. I know a lot of providers need at least 100 hours of training annually for their profession. So we think that this app can be that incentive for them to invest in that.
Okay, thank you very much. Go to Beatriz.
Isaac, thank you for a wonderful presentation. So what would you say would be the first major obstacle that you would have to, that you may encounter as you try to implement this?
Some of the things that we've discussed that was a challenge with, and it's a challenge for any application, but I think with this type of application, because it's not for-profit centered, that getting kind of the business plan aspects, getting kind of people to want to get on board on this on the initial aspect, right? And what we're hoping to do in the aspects is this will be something that can be community built, because it's really going to depend on the potential patients and the value they'll have on this application. And it also is going to depend on the our healthcare providers who can see value in this application.
So thank you very much. Thank you very much for your answer. I'd like to go now to our last comment from Mikal.
Yeah. So I appreciate that the app addresses both sides, the patient and the provider, and gives them compelling reasons to want to use it. I also see that there could be potential for patients to be able to use the app to provide feedback to providers so that they can improve the service that they're offering. So thank you.
Okay, so thank you very much for all presentations. Now I give back to my colleague Martina.
Thank you.
Then she's running the show. And Martina, please go ahead.
Yeah, please, let's turn to the next slide. Yeah, thank you. Wow, I'm impressed, and I'm sure everybody else is too. We have 8 teams, and I must say it's been quite a ride and a pleasure to watch you grow and mature your ideas from very initial stage on Friday night to today's presentations. Congratulations, everybody. The next steps are that we will meet with our wonderful judges, and we will compare the notes, look at the scores, and determine who are the 3 winning teams. Thank you, Beatrice, Alicia, and Mikkel. And last but not least, thank you to co-organizers Kiliana, Karin, and Dana, who have been very dedicated in supporting all of you. So thank you, and let's meet up at 4 p.m.